Hi, I'm Dr. John Digert with myhealthconfidence.com. In this video, we're going to talk about this public health recommendation that doctors ask their patients if they smoke, advise them that they should quit, and then offer them help with quitting. So when it comes to smoking, I've got some good news and I've got some bad news. Let's start with the bad news. 42.1 million Americans still smoke regularly, and tobacco use remains the largest preventable cause of disease, disability, and death in the United States. There are over 480,000 premature deaths every year in the United States that are related to tobacco use. That's 1 out of every 5. Now for some good news though. People are smoking less and less all the time. Between 2005 and 2016, the percentage of US adults who smoke has decreased from 20.9% to 15.5%. Going back even further in time, there were more than twice as many smokers in 1965 as compared to today. So we're winning this war, even if it's happening kind of gradually and slowly. There's better public awareness now of the harms of smoking, and we also have better treatments. And explaining treatment options is a good way to get patients over the hump and into a mindset of actively quitting. And promoting that mindset is really important. It also helps to discuss the rewards of quitting smoking, which are real and they're dramatic. Quitting smoking decreases the risk for cardiovascular diseases, pulmonary diseases, and many types of cancer. Quitting saves former smokers tons of money. If a person smokes 1 pack of cigarettes per day, they'll save more than $2,000 every year after quitting. And for those who quit, their sense of smell improves and food tastes better. You get rid of that staining of the teeth and fingernails, and skin and hair have a younger, healthier appearance, and your clothes and breath don't smell like smoke anymore. So in short, there clearly are upsides to quitting smoking. And the truth is, many smokers would like to quit, but they predictably run into a number of obstacles. For example, sometimes people who are motivated to quit live with a smoker who doesn't share the same motivation. This lack of support, along with the constant exposure to temptation, can be quite a barrier. Others suffer from mental illness or poor motivation or stress. All of these hamper efforts to quit. Sometimes people are worried about the withdrawal symptoms or have attempted to quit in the past and they feel frustrated and ashamed of past failures in those attempts. And it's good to recognize those, but then to think of them only as obstacles and decide that you're going to beat this thing anyway. Because obstacles are annoying, but you can figure out a way to get around them. And it's good to know where they are. And now that you've decided you're going to beat this thing and become a former smoker, let me tell you about all of the things that might be able to help you. I'm going to start with a quick review of the medications because they all demonstrate a significant impact and they're all FDA approved. We're going to start with nicotine replacement. This medication's over the counter, but it should be discussed with your doctor before starting because it's not appropriate for everybody. But here are the basics. Nicotine replacement helps by alleviating withdrawal symptoms and cravings. It's been shown to increase the chances of successfully quitting by 50 to 70%. And it comes in many different forms. It's available as gum, patches, lozenges, inhalers, or even a nasal spray. The second medication we're going to talk about is Varenicline. Varenicline is a prescription medication, so it obviously needs to be thoroughly discussed with a trusted healthcare provider before starting. It helps by reducing cravings and decreasing withdrawal symptoms. This drug increases the chances of quitting successfully by 2 to 3 times. There are some potential side effects with this medication, however, including insomnia and bizarre dreams, and it may increase the risk for a cardiac event. The third medication is Bupropion. Bupropion is a prescription medication, so once again, you always have to discuss this with your healthcare provider. Studies have shown that this medication doubles the chances of successfully quitting, but it's not a safe option for people with a history of seizures or with eating disorders. Additionally, there are interventions that don't involve medication and have proven effective as well. One of these is undergoing behavioral counseling with a trained therapist. This may be a good option for those who are hesitant to take pharmaceuticals or for pregnant patients. And another support system that can improve the chances of success is the telephone quit line, which provides access by phone to trained counselors. The number for the quit line is 1-800-QUIT-NOW. That's 1-800-784-8669. And people who access this counseling by phone are twice as likely to successfully quit than those who do not. So in summary, it's great to see a trend moving in the right direction, and smoking cessation appears to be one of those trends. If you are a smoker, don't hesitate. We've got all kinds of things that can help you become a former smoker. Start planning, get a healthcare professional on your side, develop a strategy, put forth the effort, and become another success story. And lastly, if you are not a smoker, but you know and love someone who is, I want you to be that annoying person that passes this video on to them.